Okay, I think we're good to go. So welcome to It's Worth a Shot. Today we're going to be talking about understanding skin cancer, screening, and detection. So we thought this was kind of a timely topic with it being the middle of summer and some of our states being in massive heat waves, while others, I was just discussing, I'm in Alaska, it's only 62 degrees and overcast here, but that doesn't mean you don't need to take care of your skin. Let's go to the next slide. As always, we just have a quick disclaimer that we do have third parties that present on our webinars, and that doesn't mean that the information is endorsed or recommended by Mountain Pacific, but we like to give as much deep information out as possible. So just a heads up. Next slide. So we only have one update reminder for this week, and this is a shot in the arm, how primary care boosts Centers for Disease Control and Prevention's vaccine efforts. This is geared towards the younger population, not necessarily the population that we have in our nursing homes, but the idea is about family and how making sure that your boosters are up to date and whatnot, and that it's just good information to share for everybody. So again, that's going to be a CDC webinar on August 2nd. Next slide. So we do have new topics every week, and we hope that they are meeting your guys' interests and needs. But if not, please definitely in the chat, let us know if there's any topics that you would like covered, or anybody, if you think that there's a great presenter out there that we have overlooked, please nominate them, and you can go ahead and tell them that you voluntold them instead of volunteered them, because we take any kind of volunteer. We will have an evaluation in the chat that Mary drops in there for us. That's another venue that you can select to let us know topics and different information that you would like for us to cover. So if you go ahead and fill that out, we greatly appreciate it. And then we have a polling question today. All right, has your facility started on your assessments per QSO 2412 nursing home memo that was due August 8th? Okay, so we got a couple answers there. If you haven't, or you don't know what we were talking about, go ahead and feel free to drop your name and email in the chat, and we'll reach out to you. Or again, you can fill out the evaluation and ask us a little bit more about that information. And again, we can get that information out to you. So it looks like we're sitting at about 50-50. If we can get 2 more people to fill it out, I'd appreciate it. Let's get to 10 of the 26th. And then we'll go ahead and close that out. There we go. We got our 10 of 26. Thanks for your guys' participation. Okay. Go ahead and go to the next slide. Oh, looks like we have a second question. Never mind. Have you reviewed your role in your facility's emergency preparedness policy within the last year? If we can get another 10, that'd be great. Looks like mostly yeses, so that's great. Give it a few more moments. All right, you can go ahead and close that out now, Mary. All right, thanks so much, guys, for your participation in the polls. Let's go ahead and go to the next slide. All right, so today I want to introduce our speaker. Her name is Dama Quick, and she's with the Wyoming Cancer Resource Coordination and Coordinator. I'm sorry, she is the Wyoming Cancer Resource Coordinator for Region 2 in Wyoming. She's a certified community health worker through the University of Wyoming, and as an ACS Leadership in Oncology Professional Patient Navigator. She's driven by a deep passion for supporting oncology patients and a passion that precedes its personal impact on her own daughter. Dama is dedicated to improving cancer care and resources. Her work focuses on guiding patients through their cancer journey, providing essential resources, and advocating for accessible cancer screening and prevention programs. So I'll go ahead and turn it over to you, Dama.
Thank you, Miranda. Okay, well, good afternoon, everybody. My name is Dama Quick. Like Miranda said, I am the Wyoming Cancer Resource Coordinator for Region 2 here in Wyoming. Region 2 covers Carbon, Converse, Natrona, and Niobrara counties. But if you have any other needs in different counties, please feel free to reach out to me and I will try to help you out. We are also known as WCRS. So if I say that going forward, you know what I mean. So WCRS is part of the Wyoming Cancer Program, which is part of the Wyoming Department of Health Public Health Division. We are community-based coordinators that provide support services to Wyoming residents, including education, early detection promotion, and patient navigation. WCRS also refers clients to cancer screening programs and provides resources like transportation and financial assistance. Through collaborative partnerships, the WCRS utilizes resources within communities to fill service gaps through the continuum of care. I am currently housed at the Casper-Natrona County Health Department. So, introduction to skin cancer. So skin cancer is characterized by the uncontrolled growth of abnormal skin cells. This condition arises when DNA within the skin cells incurs damage, often due to exposure to ultraviolet or UV radiation from the sun or tanning beds. This DNA damage leads to mutations, which disrupt the normal cell cycle and cause the cells to multiply uncontrollably. The types of skin cancer are basal cell carcinoma, which is the most common form of skin cancer, squamous cell carcinoma, which is the second most common type of skin cancer, and melanoma, which is less common than the other two, but significantly more dangerous. Next slide. So some statistics and prevalence. Global statistics, skin cancer holds the title of the most common cancer worldwide, reflecting the significant global burden it places on the healthcare system. Millions of new cases are diagnosed each year, indicating the widespread prevalence of the disease. The high incidence rate is attributed to various factors, including increased exposure to UV radiation, aging populations, and enhanced detection methods. In the United States, skin cancer remains a major public health concern. Annually, over 5 million cases are treated, encompassing both non-melanoma and melanoma skin cancers. The sheer volume of cases underscores the need for robust preventative measures, early detection, and effective treatment strategies. Public health campaigns emphasize the importance of sun protection and regular skin checks. Focusing on a more localized perspective, data from Wyoming between 2017 and 2021 reveal 874 reported cases of skin cancer. This statistic highlights the occurrence of skin cancer even in less densely populated regions. Notably, 7.5% of these cases were diagnosed at late stages, emphasizing the critical need for early detection. The state recorded 105 deaths attributed to skin cancer during this period, reflecting the serious nature of the disease when not caught early. Skin cancer predominantly affects fair-skinned individuals due to their lower levels of melanin, which offers some protection against UV radiation. However, it is important to convey that skin cancer can develop in anyone, regardless of skin color. Everyone should use preventative measures and seek medical advice if they notice any suspicious changes in their skin. Next slide. So we're going to talk about risk factors. The primary risk factor for developing skin cancer is exposure to ultraviolet or UV radiation. This includes both natural sources, such as sunlight, and artificial sources, like tanning beds. UV radiation can damage the DNA in skin cells, leading to mutations that cause uncontrolled cell growth. It is even more important to protect the skin from UV exposure at higher altitudes like Wyoming and Montana. UV radiation levels increase significantly due to the thinner atmosphere in higher altitudes, which provides less protection from the sun's harmful rays. So remember, for every 3,200 feet increase in altitude, UV levels can rise by 10 to 12%. So this heightened exposure increases the risk of skin damage, sunburn, and long-term health issues like skin cancer. It's crucial to take extra precautions, such as wearing broad-spectrum sunscreen, protective clothing, and sunglasses to safeguard against the intensified UV radiation in high-altitude environments. Physical characteristics that are primarily high risk. So individuals with certain physical characteristics are higher risk of developing skin cancer. Those with fair skin, light hair, which is blonde or red, and light eye color, which is blue or green, are more susceptible because they have less melanin, which provides some protection against UV radiation. These individuals should be particularly vigilant about sun protection and regular skin checks. A family history of skin cancer also increases an individual's risk. This genetic predisposition means that if a close relative, such as a parent or sibling, has had skin cancer, the person's likelihood of developing it is higher. This information underscores the importance of knowing one's family medical history and discussing it with a healthcare provider. Having a personal history of skin cancer significantly increases the risk of developing the disease again. Individuals who have experienced severe sunburns, particularly blistering sunburns, are at greater risk. These factors highlight the need for ongoing vigilance and preventative measures for those with a history of skin cancer or sunburns. The presence of many moles or atypical moles can increase the risk of melanoma, a particularly dangerous form of skin cancer. Atypical moles are often larger than normal moles and have irregular shapes or colors. Individuals with numerous or atypical moles should have regular skin examinations by a dermatologist to monitor for any changes that could indicate skin cancer. Next slide. So now we're going to go through the skin cancer types. So basal cell carcinoma, like I said before, is the most common type of skin cancer. It is generally slow growing and rarely travels to other parts of your body. Due to its slow growth, it can often be treated effectively if detected early. Places that normally basal skin cancer is found is on sun-exposed areas of the body, particularly the face, neck, and hands. And a lot of us forget sunscreen on our hands, but don't forget those hands. These areas are more vulnerable to UV radiation, which contributes to the development of basal cell carcinoma. It typically appears as pearly or waxy bumps. These bumps may have visible blood vessels and can sometimes ulcerate. It can also present as flat, flesh-colored or brown lesions that resemble scars. These lesions may have a translucent quality and can be slightly raised or flat. So squamous cell carcinoma can grow more rapidly than basal cell and has a higher potential to travel other places in your body if not treated promptly. Early detection and treatment are crucial to prevent the spread of squamous cell carcinoma. It often develops on sun-exposed areas of the body, such as ears, face, neck, and hands. Chronic exposure to UV radiation increases the risk of this cancer in these areas. It may present as a firm red nodule These nodules can be tender to the touch and may ulcerate. It can also appear as flat lesions with a scaly, crusted surface. These lesions can become larger and more pronounced over time. Now to melanoma. It's the most aggressive form of skin cancer and can spread quickly to other parts of the body. It originates in the melanocytes. Sorry, I can't talk today. The cells responsible for producing melanin, the pigment that gives skin its color. Early detection is critical for successful treatment. Melanoma can appear anywhere on the body, so it is very different than the other kinds. This includes areas not typically exposed to the sun, such as the soles of the feet, palms, and under the nails. It is also commonly found on the back, legs, arm, and face. Melanoma often appears as large brownish spots with dark speckles. These spots can be irregular in shape and color. It can also develop from an existing mole that changes in color, size, or feel. Melanomas have irregular borders and can be multicolored, so shades of brown, black, red, white, or blue. Next slide. So signs and symptoms. We talked about what it could possibly look like, but here's some more tips. So it's called the ABCDEs of melanoma, and this is specifically to look for melanoma. So asymmetry, and when you're looking at this slide, you can see as I'm talking what it means on those different pictures. So when evaluating a mole or spot, check if one half is different from the other half. Melanomas are often so whereas benign moles are usually the same. So if one side is round and the other side has jagged edges, you know that that doesn't match. Next, you're going to look at the border. Examine the edges of the mole or spot. Irregularly scalloped or poorly defined borders are a warning sign of melanoma. Blurred or jagged edges can signify uncontrolled cell growth and invasion into surrounding tissue. Next, you're going to look at color. Look for a variety of colors within a single mole or spot. Melanomas can have multiple shades of brown, black, tan, and even red, white, or blue. Uneven distribution of color or the presence of multiple colors is a red flag. Next, you want to look at the diameter. Measure the size of the mole or spot. Melanomas are typically larger than 6 millimeters in diameter, so it's about the size of a pencil eraser. While smaller melanomas do exist, size is usually an important factor in assessing your risk. Pay attention to any changes in the mole or spot over time. Melanomas often change in size, shape, color, or elevation. Symptoms like bleeding, itching, or crusting are also significant indicators that a mole may be cancerous. So basal cells often appear as the pearly or waxy bumps, and they may have visible blood vessels and can sometimes ulcerate. Another presentation of that kind is flesh-colored or brown scar-like lesions. These can be shiny or translucent. Squamous cell may present as firm red nodules. These can be tender and may ulcerate. Another common appearance is flat lesions with a scaly, crusted surface. These lesions can become more pronounced over time. Next slide. Regular skin checks are crucial for the early detection of skin cancer. Early detection greatly improves the chances of successful treatment and can prevent the cancer from spreading. Both self-exams and professional exams play an important role in monitoring skin health. So self-exams, you should start, ideally, you should begin at 18. Individuals at higher risk, so those with a family history of skin cancer, fair skin, or a history of severe sunburns. Also, some medications that people take can make you more high risk My son took a biologic, and so that made him more susceptible for skin cancer. So we, make sure you read those and talk to your doctor about that, because then you know to be even more careful and what to watch for. So if you have anything that makes you high risk, you should start self-exams earlier. So how do you perform a self-screening? You can use a full-length mirror and a handheld mirror to examine your entire body. Check all areas, including those not regularly exposed to the sun. Don't forget less visible areas such as the scalp, behind the ears, the soles of the feet, and between the toes. Look for any new moles or changes in existing moles, including changes in size, shape, color, or texture. Make sure you use the ABCDE rule that we just talked about to assess the moles and spots. A dermatologist's role is to provide annual skin checks. They're recommended for most people. High-risk individuals may need more frequent examinations. During a professional skin exam, a dermatologist will conduct a thorough check of your entire body, including hard-to-see areas. Dermatologists have the expertise to identify suspicious lesions and can perform biopsies if necessary to diagnose skin cancer. Regular visits to a dermatologist can lead to the early detection of skin changes that may not be noticeable to the untrained eye. Next slide. So next is prevention measures, because we want to prevent any of this from ever happening. Sunscreen use, so SPF 30 or higher, recommended using UVA or UVB blocking sunscreen. 30 or higher blocks approximately 97% of UVB rays, reducing the risk of sunburn and long-term skin damage. Broad spectrum protection. Ensure the sunscreen offers broad spectrum protection, which means it protects against both UVA and UVB rays. UVA rays penetrate deeper into the skin and contribute to premature aging and skin cancer, while UVB rays are the primary cause of sunburn and skin cancer. Apply sunscreen generously to all exposed skin 15 to 30 minutes before going outside. Reapply every 2 hours or more often if swimming or sweating. Don't forget areas like the ears, neck, and tops of feet. Also, when buying sunscreen, make sure you pay attention, because some of them say waterproof 80 minutes, 90 minutes. So just make sure that you're paying attention to that if it does list that. If it does not, just make sure you reapply every 2 hours. So you want to get sunglasses that block 100% of UVA and UVB rays to protect the eyes and the surrounding skin. Wear long sleeve shirts, long pants, and clothing with built-in UV protection. Darker colors and tightly woven fabrics often protect you better. Stay out of the sun as much as possible during peak hours when UV radiation is the strongest. If outdoor activities are necessary, seek shade and use additional sun protection measures. Seek shade, especially between 10 a.m. and 4 p.m. Use umbrellas, canopies, or trees to provide shade during outdoor activities. It is so important to keep up on annual skin checkups with a dermatologist for professional evaluation and early detection of skin changes or abnormalities. The recommendation is to perform self-exams monthly to monitor for new moles or changes in existing moles. Use the ABCDE rule to assess any changes that you may have. Next slide. So as we wrap up, I want to leave you with some valuable resources to further your understanding of skin cancer and its detection. One notable program is Skinny on Skin, offered by Impact Melanoma. This is a certification program designed to educate professionals on identifying potential skin cancers, ultimately aiding in early detection and treatment. This program was originally made for hairstylists and like estheticians who normally see skin, but it takes an hour of your time, and it really helps to figure out what you're looking for, especially in your clients. Thank you for your attention and dedication to learning about skin cancer. Together, we can make a difference in the fight against this disease. If you have any questions or need further information, please don't hesitate to contact me or the Wyoming Cancer Program. You can also scan the barcode on the next screen to access my business card. Next.
Sorry, we have that scan. It's just the next slide after this. So we just put it right before the closing. So there is a card or a slide that has the QR code on it.
Yes, there we
go. So there we go. There's Dama's contact information. Thank you so much, Dama. Really appreciate that information. And I thought I'd just add that while we were talking to her prior to her coming on It's Worth a Shot, we thought that that training program was actually rather interesting because, you know, like she said, it was made for hairdressers and things like that. But also, you know, nursing home staff does do, you know, help with bathing and different things like that with their residents. And so it could be something that would really be beneficial to have some of the staff trained on what to look for when it comes to skin cancer and, you know, to have that certification. So that way, you know, it's a not selling point, I don't want to put it that way, but I mean, definitely a point in your guys' favor to let the family know that you're also observing for, you know, abnormalities on the skin and whatnot to help, you know, watch for that while you're caring for them in the facilities.
And
so we can go
back.
back.
A free program.
Yeah.
It's a free program. And it literally took me an hour, and it's so good because when you need a refresher, you just go through, look it over again, you know, and I will email you guys too. It's an information sheet where when people do their monthly checks, they can write down any problem areas that they may have, like any measurements that they do, how it looks, so that the next month they can keep track and see if there's any changes. So I will email that to you guys, so that if you send things out, you could attach that as well.
We sure can. Thank you.
Yeah,
so does anybody have any questions for Dama today about her presentation or anything in general? Feel free to come off mute or put it in chat. Looks like we've got a quiet crowd today. Okay, so Mary just popped our evaluation into the chat again. So if you guys will fill that out and populate it with any kind of information you may want, or if you need to reach out to us about questions with the memo from our previous polling question, then you can do it there. Again, I want to thank Dama for her presentation. Always nice to have an outside view and also bring very useful knowledge. We can go to the next slide, Mary. All right, so I hope you all can join us next week on the 31st. We will be doing a presentation on an EPP tool, and our own Callie Perkins will be doing the presentation. So again, I want to thank you all for joining us for this half hour. Thank Dama again for her presentation, and we hope we see you guys all next week. So have a good week. Thank you.
Thanks for having me.
Thanks, Dama.